So even though our slide here niftily says that we will get started at 6:05, I think we can get started just about now. It's 6:04, and I don't want to hold anybody up. I know that some of our presenters are on a pretty short schedule this evening, so I'm hoping to keep this pretty condensed and contained. Greetings, welcome. My name's Andrea Boykowicz. I'm the Assistant Director at Oakland Planning and Development. This is our monthly community-driven discussion session called Let's Talk, and every month we feature a new topic that is of interest and concern, things that we hear when we are talking to folks in the neighborhood. And our topic for this evening is about increased the concerns about potential for increased spread for COVID going forward into the fall. What is monkeypox? Is it contagious and do we need to worry about it? What kinds of precautions should we take? And with any luck, some indication from the University of Pittsburgh about any kinds of special postures that the university is planning for its students who are in the process of coming back. That arrival survival begins next week, and we want to make sure that we have the information we need to actually survive arrival. So very grateful to our presenters this evening, Dr. Raquel Tripp, who has been with us before, and we're so happy to have you back. Actually, last year at about this time on more or less the same topic, and hopefully there's new updates that we're all used to it at this point, and it's a little bit more normal. And then I saw that Justin Vandoy is here from the University of Pittsburgh, and Justin, I'm not sure if there was anybody else that you wanted to tap who might be presenting from Pitt, but we're happy to get to that in just a minute. So welcome everybody. Like I said, we're going to have a little discussion. I'm going to ask Dr. Tripp to give us a kind of a 30,000 foot view of what we're talking about here. I would welcome anybody's questions, and then we'd like to be able to hand the mic off, as it were, to Justin to talk a little bit about what the university has in mind. Anyone who has any questions at any time, you're welcome to drop them in the chat, to raise your hand. If you'd like to just interrupt with, excuse me, I have a question, we can take those as well. There's not too many of us, and we can easily get through this quite easily. So that's it, that's what I've got. I'm handing the mic over now to Dr. Tripp.
Thank you so much, Andrea. It's truly a pleasure, and especially to come back. And then I think my colleague, Dr. Ken Ho, is on also, I believe.
Yep, I'm here.
Yeah, where you at? Thank you, fantastic. So just because I want to be mindful of my colleague, Ken, who unfortunately has to go just with some time constraints and some prior engagements, just introducing my friend Ken, who is an infectious disease doctor. So he's in the nitty gritty, basically all the infectious disease highlights that's going around internationally and within our own United States. So Ken, I will let you start it off, just to kind of give a background about, monkeypox, what is it? What are the signs and symptoms to look for? And then if someone does get infected, what are the things they should prevent? And then for their family, things that they should do to prevent from getting infected also, and then any updates on new variants of COVID that you might be able to share.
Good. All right, sounds good. I'm in the car, and I'm not driving right now, but so yeah, we've been working on monkeypox probably for the last several months or so, and I guess trying to summarize everything in a couple minutes is a challenge, but I'm going to attempt to do it. All right. So monkeypox is a virus that is considered a zoonosis, meaning it infects both humans as well as animals. With the name monkeypox, you would think that the kind of host animal is monkeys, but that actually was where it was first discovered, which was in research monkeys. It's actually the actual host and where the virus tends to kind of circulate or whatever is thought to be certain rodents and small mammals in Africa. And it is endemic to the Western and Central Africa regions, where it's been circulating probably for decades. Every once in a while, you see an outbreak that occurs in another part of the world. Probably the most famous one being in 2003, which was related to prairie dogs. And what are prairie dogs? What's the relationship there? And I guess in the place where they were stored next to these African Gambian rats, which are like 3-foot long rats that are now illegal to ship, by the way. And those rats were infected with monkeypox and transmitted them to the prairie dogs, who transmitted them to their owners by small bites and scratches throughout the Midwest. There were about 47 cases, and this was in 2003. So an outbreak that was very different from what we're seeing today. So fast forward today, this year's outbreak is kind of originated, or at least was first the first cases were found in the United Kingdom in 3 separate clusters, one of which was in gay and bisexual men, one of which was travel related, and another, they're not even quite sure. But the reality is these were probably just the tip of the iceberg. It was probably circulating in the community even before then, and has continued to spread across the globe. With now, I think we're seeing over 30,000 cases as of, I think, earlier this week. I think 11,000 cases in the United States, in Pennsylvania, close to 300, and in Allegheny County, we have, I believe, 45 as of yesterday. Monkeypox itself is similar to smallpox in many things, including the vaccine and the treatments for smallpox have been used for monkeypox successfully. So when we think of, what does this look like? It's most common kind of thing that we associate is this rash, which can look like a lot of different things. It's usually all over the body. It's usually, the classic is these kind of deep-seated kind of pustules, so meaning little bubbles that are full of white pus that are sometimes, even sunk in the middle because they're so full of pus. And what else? And yeah, they can be all over the place. But I think what we're seeing differently with this year's outbreak is that it's not necessarily everywhere. I think we're seeing it in places that we don't usually see it. And by it, I mean the rash. So the rash is sometimes showing up just in the genital region, or just around the mouth, or just around the rectal area, which is different from the way monkeypox is thought to have presented before. We're seeing cases of proctitis, and by that we mean kind of rectal inflammation. So people having a lot of pain going to the bathroom, having a bowel movement, having blood or mucus coming out as well, which is just as unpleasant as it sounds. So a lot of times people call monkeypox, it's mild, and well, it's mild in that it doesn't kill you, but it often can land you in the hospital if pain's so bad you need, IV medication to just, eat or have a bowel movement or just kind of, stay conscious. And so, where we are seeing monkeypox right now is largely in queer communities, mostly gay and bisexual men, which I think we also want to be cautious about because, the first community that tends to have an infection oftentimes gets blamed for it. And that's not what makes sense. That's actually what I think often causes an infection to persist even longer, because then you get stigma, you get people who don't want to seek care because of fear of stigma, and that just makes everything worse. The reality is viruses are blind to sexual orientation, gender identity, race, and ethnicity. They just infect people. And the way monkeypox is transmitted is largely by close contact. It's not considered specifically a sexually transmitted disease. That's not quite known. It very well may be sexually transmitted, but it's sort of hard to have sex without close contact. So it is that close, skin to skin contact that causes transmission of monkeypox. Think more like MRSA than like syphilis, though probably the right answer ultimately will be both. Towels, bedding, clothing worn by somebody who has monkeypox with active lesions can potentially transmit. It can go from mother to baby. And then of course we talked about the animals as well, which is interesting because if you looked at the news yesterday, the first case of a dog getting monkeypox from its owners was just reported in France. No reports of pets getting it and then transmitting it back to other people, but this is the first of its kind. It's causing a lot of stir, but my sense is this is not going to be a huge thing. And there is guidance to, if you're sick, you probably shouldn't be cuddling your pet as well. And the final thing is by breathing in the air. And this has to come with a caveat because it's not COVID-19 where, transmission is very likely, but rather these are large droplets that kind of fall to the floor. And so by comparison, the CDC considers for COVID, an exposure to be 15 minutes maskless within 6 feet with somebody who's positive for COVID. For monkeypox, it's 3 hours. So a lot more. It takes a lot more for somebody to get monkeypox through the air. And if you think about it, if monkeypox were transmitted easily by air, we would see a lot more cases now than we're seeing. We probably see a doubling of the cases every 1.5 to 2 weeks or so. So it's increasing at a rate far lower than COVID, but it is causing a lot of issues. We're struggling. One of the advantages is we do have a vaccine, which is called the Jynneos vaccine. There are two types. We are using the Jynneos just because of safety issues. I'm not going to get into kind of all those reasons, but the availability of it is quite limited. So it's just being prioritized for those at highest risk for monkeypox. So they say people who have been exposed to monkeypox and people who are in areas where they may have very well been recently exposed. And so those are the folks. And the state has various criteria, which also I probably won't get into just because they're a little complicated. But where we are seeing monkeypox transmission have been like the bathhouses, campgrounds where people are kind of very close to each other, some festivals and parties, people who are traveling, things like that. And if you go to the health department website, there is a list of institutions that are providing the vaccine. So there is some vaccine supply right now. We're looking at different ways to stretch it out as much as possible. For example, they're talking about instead of giving a full dose under the skin, if you divide that full dose into fifths and give it inside the skin, what's called intradermally, like a TB test, you can actually, there's some data to suggest that the efficacy is just as good and that you're going to be able to take your single dose and make it into 4 or 5 doses potentially, which comes with a lot of benefit there too. So a lot of questions being asked right now. Is the general public at risk for monkeypox right now? No, not necessarily. We don't have to stop going to the movie theaters or swimming pools or what have you. But I think it's important to have an awareness of how monkeypox transmits and to I think be careful to avoid stigma and say, oh, it's just a gay disease or it's just an African disease, because it's not. And if we don't do our part to try to control it and support the other communities that are impacted, then I think it becomes all of our problems. It is all of our problem, because everybody can get monkeypox. And so with that, I'm just going to mention that there is also a treatment, antiviral treatment for monkeypox, which we are coming up with a system over at UPMC for distributing. It's also limited, but the good thing is, very few deaths from monkeypox. No one has died in the United States yet. And it just causes a lot of pain and suffering and potentially even scarring. So it's not something that anybody wants. With that, I'll stop the part about monkeypox. I don't know how, in terms of COVID, which is a slightly different virus, it's an RNA virus as opposed to a DNA virus, and it's a respiratory virus. We are seeing increases again. It's sort of been like increasing and decreasing and increasing some more all summer. The BA variants are predominant now. That's what is thought to be the case. And the good news is, I think we are on the cusp of a new booster that is variant specific. And I've heard anywhere from September to November in terms of the release date. I think hopefully a little earlier rather than later. And I think that vaccine, when it comes out, we'll have to see what guidance comes with it. I think that really will help control the epidemic. In addition to the fact that people who are getting the vaccine, who are getting COVID itself, and there are a lot of them, will probably have some protection. So that kind of contributes to overall herd immunity as well. So I don't know that we have really good guidance. Should I wait for the vaccine to come out, or should I take a booster now if I'm due for it? There's no right or wrong answer. I think what I've been telling my patients is that, if you have a situation where you're thinking you might be really at risk for COVID, going to a wedding, maybe it makes sense to go ahead and get that second or even first booster now, to just give yourself as much benefit as possible, realizing that it may not be 100%. And if you have those risk factors for severe disease, to continue, to take those precautions, wear a mask, try to do things outside so that you have as much protection as possible. The vaccine is not 100%, but it can only help. As opposed to, if there's no urgency, you might be able to wait for the variant-specific vaccine with the idea that you might be able to get it a little bit earlier, because usually they space out timing between the boosters because of concern for certain side effects. That's the main thing that I have in terms of COVID. I think I spoke for 15 minutes or sorry. I guess maybe I'll just open it up to questions and things like that. Would that be reasonable now?
Ken, that would be fantastic. I just want to say I'm thoroughly impressed. You've had so much information in such a short period of time that I am very impressed. It just, yeah, wanted to leave the questions to the audience. I will say my background is emergency medicine. So I look at it more on the clinical aspect. And so Ken actually got a consult from me, was it last week, I believe,
Yes.
for a patient that had an exposure to a person who had monkeypox and she had now developed lesions. And then the one thing about monkeypox is that it has this large incubation period from like 4 days to like 21 days. So that's the other difficult thing about monkeypox, is that you can have this exposure, but then it could only this rash could appear on like the 20th day. And then you have to take into account how many people has this person been exposed to. Now, I will say, I think, when the lesions are there, and they're not scabbed over, that's when I think you're at the height of infection. And that's when you can transmit very easily. But however, I would say, definitely that was the only case that I've seen in the ED personally. And then I will say that when it comes to COVID clinically, I have seen an increase. And for me, it's been about 50% of those who have been vaccinated and those who have not been vaccinated. I will say those that have not been vaccinated having a bit more severity in the disease. And so those are usually the people that I do have to hospitalize because they have a decrease of oxygen level in their blood. And so they're requiring oxygen. And compared to people who are vaccinated that now have an infection where I may give them Paxlovid, which is an antibody.
Antiviral.
Thank you, antiviral. Thank you, Ken.
Yes.
So that's something that we give as in pill form that we can prescribe, which I think is over, I believe, 5 days. And it can be decreased with the dosage depending upon if you have any kidney issues. But that has also been helping people who have been infected with COVID to shorten the duration of symptoms and also the severity of the infection. Because I will say that, and Ken definitely, please speak to this, but I have seen multiple people having sequelae, which they're having, long-term effects of COVID infections. And, where I at least I would say from my experience in listening, that it's really, I think, a bit more that's coming up with some of the new variants compared to the older variants, where people will call the long haulers, or people that are having long-term effects of COVID. And that can include headaches, fatigue, feeling very winded, not having as much ability to exercise, which they're taking, months for recovery. So that's just at least from the clinical aspect to add on to this. But definitely want to leave it open to all of you to ask any questions that you may have for either Ken or I.
Please, anyone, if you have questions, just go ahead and unmute yourself.
Hi, my name is Jeremy. I'm actually the youth engagement specialist with Oakland Planning and Development. So hence me still wearing a button up at 6:30 p.m. But first of all, I want to thank you both for being here. Just a quick question about the variant specific vaccines. I know this is probably a question you get with not infrequently, but is there any concern that the variant specific vaccines will not be will, I guess, pigeonhole the vaccine into only treating those variants, and then if a new variant comes up, it will require a redevelopment of another vaccine for those variants? Or is there some amount of confidence that any new variants will follow a similar path? I mean, never done any virology, so I don't know if there's a pattern to any of this. But
Ken, I'm going to leave that one to you.
That's a bit of a high level question, right? I think
I'm a little bit of a nerd. I'm sorry.
And to be perfectly honest, I think I don't know that anyone truly knows the answer to that. I do know that, it seems that there's been some suggestion that there is a certain predictability to the way the virus mutates, such that like similar variants will sometimes develop simultaneously in different geographic locations, which makes you think, okay, there is something about this science that we can sort of try to harness or control. I mean, I think whether the vaccine itself, because I don't know about the vaccine, is kind of going down that pathway that it will kind of arrest that that evolution is not clear to me. My thing, though, knowing what I do know about virology, is if you can just prevent infections more. If you know, the problem with these variants and the breakthroughs is that they continue to replicate. RNA viruses like coronavirus, SARS-CoV-2, they tend to replicate and they make mistakes, and then they continue to mutate. If we can, you know, really do our part to prevent infection, that will help to stall, I think, the development of new variants. And I guess all I can say is that I do hope that the variant specific vaccine will do that, as opposed to being something that is purely just reducing severity of disease, that it actually prevents infection.
Gotcha. Okay, thank you very much. I appreciate it.
Sure thing.
I'd like to ask a question, if I may, which is that, like, even though we do see these kind of, you know, fluctuating but always alarming rates of infection in Allegheny County, infection and reinfection, we're not as necessarily panicked about it as we were, say, a year or 2 years ago at this time, you know, in terms of what the implications are for the healthcare system, or, you know, what the survival rate is for the people who do become seriously ill. I'm kind of curious to know if that is more a function of the prevalence of vaccination in the population, which is to say people are getting less sick because they have some kind of immune support going into the infection, or if it's more to credit the changes to how the disease is treated once people are in the hospital. So, like, you know, people are no longer automatically intubated, and, you know, there are more medicines and there are more treatments that are available for doctors to use. So I was just kind of curious to know, or is it just that we should be panicking and we're not?
Gotcha. Listen, I would say, at least from my opinion, you know, excellent question. I think there is some desensitization that people are kind of in a isolated bubble of not trying to normalize things without realizing that, like, people will come to me and like, oh, well, you know, COVID is done, like the pandemic is over. And I'm like, no, it's endemic. Like, literally, COVID is still around you. You may not be as aware, try to pay attention to it. It's not like the hot topic on news anymore, because I think after having at least 2 years of having it all the time, people have gotten so much fatigue. And so you're having a certain subset of people that are kind of in denial, per se, of, you know, of like COVID still being in existence. Now, I will say that definitely with, you know, different monoclonal antibodies from Paxlovid, that's now an oral pill. We have Zemzavir. We had other monoclonal antibodies, which unfortunately with production have like gone off the shelf, and then having some decrease of you know, production, that definitely, I would say, there has been some increase in different treatments. But I would say, similar to like what Kim was saying, is that it's really about the prevention. So you still have, you know, people wearing masks. You still have people realizing that if I'm going to go into a social function, it should be outdoors. And so that really has been what has kind of had this fluctuation, where we're having more of, I would say, a controlled infection rate in some aspects. I will say what's going to be interesting is when we get out of the summer, where now people are all outside, and then go into the winter, where now people have to be indoors. And so I would like to see how those rates, because I think what we're seeing is more of people being outside or still having that preventive measures going on. Because I would say, you know, looking at the statistics from UPMC, that, you know, I think the latest I saw, like, we're like at 250 with the amount of people that are admitted with COVID. And these are not counting the people that have COVID that we can discharge. And so I do think that we're still having a rise in COVID cases, but I think it's not as much as so much of alarming as before, because you're having that fatigue that people don't want to hear about it anymore. And then also you're in the summer, so you're not having as high of an infectious rate because people are doing some preventive measures of doing more outdoor activities. Ken, I don't know if you have anything else you wanted to add to that.
No, I think that was very well stated. There's not much that I have to add to that.
Fantastic. Thank you, Ken. I'm trying to imbue you into me. Yes. And like that ID. Thank you.
Is it fair to say it's all three?
Yes.
Could be panicking more than we are. Treatments are better, and also people are immunized or gaining in some kind of immunity. So like all three things are happening at the same time, but we still should be panicking a little bit more.
Yeah, I would say. I mean, I think at least when I was looking at like people being vaccinated, like the first time vaccinations, not as much as anymore. We have a lot of people that have been vaccinated now. A lot more people have received like that first booster. The second booster, I would say, I think senior citizens have taken that compared to other age groups. Um, so our senior citizens are like, look, we're going to stay protected no matter what. So, and I would say talking to like my senior patients, like they are looking forward to this other booster. They're like, yeah, bring it on. They're like, bring on all boosters. They're like, I don't like this. I just want to be super, super duper vaccinated. So I will say that, you do have that status of like some people being vaccinated. We still have our populations that are not, which are typically, I would say, younger than the age of 65. I had a woman the other day that I diagnosed with COVID, and she had like these like deer in headlight looks at me of like, I got COVID, and I'm like, yes, you have COVID. COVID is still in existence. So, and then she's like, well, I got all these young kids, and I'm like, well, this is why we're still promoting for wearing a mask. Now, I will say, it's been interesting of people's interpretation when you're wearing a mask. I will say that it's weird that there's some stigma per se where you'll get some weird looks if you're still wearing a mask, in public per se, where, I'm like, I wish everyone wore a mask, especially in the grocery store. But however, that is a wish that I have. But I would say that, yes, I would say, part of a bit, of all three, but I would say the higher one would be we're in a summer period where people are doing more prevention. And that's really what is limiting, for the virus, because you want to try to prevent things where the virus would propagate. And so, making sure you're not having that close, contact within like a 6 feet, without wearing a mask, longer than 15 minutes, because that's really going to propagate that virus. So, making sure you're having that, that outdoors activities for most of your social interactions is really what's helping to really try to keep it in a controlled sense for the infection rate.
If anybody has any questions to follow on that, please do ask them. But I think that would also be a great segue to pivot to the university to say, so how are we preventing people from passing it to each other as the summer wanes and people start doing more things indoors? So Justin, may I introduce you?
Absolutely.
Outstanding. So Justin is brand new in the Office of Engagement and Community Affairs at Pitt. I get to say that for another couple of months yet. I know that you've been.
Yeah, I still get a couple months of being brand new. Yep.
It'll take a couple of years for people to get used to you. And I'm very glad that you were able to join us this evening. And I'm sorry to have to put you on the spot with this, but I'm grateful to you for taking it, and hopeful that you can give us some guidance about what it is that the university is recommending its students do.
Sure. So I can sort of talk about what's, sort of what's the same and what's different than we've done in sort of past the previous past couple of years. And so, we are still, as first and foremost being that we're encouraging, our students to be vaccinated. And so, all of our community members to be vaccinated. And so that's something that's really remaining the same, as well as symptomatic and close contact testing. So the university will continue to offer testing for any students or employees who are experiencing COVID symptoms, who are in close contact with people who have recently tested positive. So students, we're going to continue to work with our student health services on campus to be arranged to be tested here. And so, so students are still able to do that through the O'Hara Center, and employees are still able to do that through our through student health services, or through My Health at Work as well. So we have are still sort of same processes for doing that. And yeah, thank you, Dr. Huff, for being here. That was really like super informative for me, because I didn't even want to dare like put like Dr. Justin Dandoy on my PowerPoint slides, or on my face, because I didn't want anybody to think that I have any sort of medical background or anything like that, because that was totally really informative for me, for sure. So we will be providing testing hours that are available for our students and employees. And so what's new for Pitt is, with our testing, we are moving to a new vendor for our testing, and that'll start, or that's starting now as students arrive, and students are able to pick up tests on campus, so they won't have their tests shipped to them at home, and sort of that's the approach that we're going to be taking there. And so we will have some mandatory testing as well. So we will have some mandatory testing for at least some segments of our unvaccinated population. And so while we understand that everyone is at risk for getting and spreading COVID, and individuals who are vaccinated do remain the highest risk population, as Dr. Tripp mentioned as well. That's what we're doing. So we understand that they're more, if you're unvaccinated, you're more likely to get COVID. You're more likely to carry higher amounts of the virus. You're more, you can become more sick yourself, or you can be contagious for a longer period of time. And so that is something that we are going to continue to address, and then we're going to continue to comply with the CDC updates at the community levels for not just our Oakland campus, but all of our campuses: Bradford, Greensburg, Johnstown, and Titusville as well. So making sure that we're staying up to date with those as well. And then finally, we're going to be having fall arrival testing. So we're going to be testing is a part of students' arrival back to our campuses to start the term. And so upon arrival to campus, all the students living in university housing will be required to test and be provided, and they will be provided with a test kit upon arrival. And so students are going to receive that information as they come to our campus. And then, but students on or off campus are strongly encouraged to take a rapid antigen test within 48 hours of returning to the area. And so we're going to have free at-home test kits that are available that can be ordered. And if we do test positive, there's measures that we will to make sure students aren't traveling or doing those things as well. So again, a lot of it's going to be staying the same from what we've done in the past, with the exception of just sort of changing some of our systems. But our goal is, if as Dr. Ho mentioned, he said, if you can really do a part to prevent infection, that's our goal. And so even when it comes to some our major events and things like that we're having in the fall, we have a lot of things going on outside, as mentioned, and making sure that we're reminding students that masks are recommended, and you'll still see those signs in the front of our buildings saying when based on the CDC status whether or not masks are recommended or required. And so we're continuing to move along with that.
Just in back when the pandemic was still raging, not last year but the year before, really pretty heavily, the the university took some steps to try and sort of like de-densify its on-campus student housing, and I'm kind of wondering if that's still in place, or if there is any sort of measure that the university is taking to have quarantine space available for students who do test positive or who are symptomatic, to sort of isolate themselves if they are experiencing symptoms.
Yeah, so I can't speak from our res life folks, but I will say that again, right now it's based on process, and so I would say that from my knowledge, and this is me speaking individually, that we are not densifying those the student housing, so it is really about making sure that students are being preventative in what they're doing, and then making sure that we're addressing that from a testing standpoint after that. And so, yeah.
Got it. So we're not going to be policing the size of parties that are happening off campus in people's houses. We're not going to be, the dean isn't going to be walking around scolding people.
Yeah, we are going to be we're going to be doing community walks, for sure, knowing, and we had done that in the past as well. That's something we're going to continue, is to make sure, seeing who's out and about and what the social scene is like. And so hoping to continue to do that moving forward, to make sure that our students are being safe, because again, it's just knowing, for us, it's knowing what our students are doing, and how we can then best respond to those things as well. So we will be, at least I will certainly be walking the communities during evenings and things as well. So
Thanks. Does anyone have any questions for Justin or for Dr. Tripp? Y'all are quiet.
I have a question.
Hello.
So, will there be quarantine housing for when students do test positive for COVID or no?
That's something that I'll actually have to find out exactly what. And so I will say this, that our unit, the COVID response unit, and the folks that are sort of dealing with these continue to meet. So it's not a sort of a plan that's saying, okay, this is what we're doing and this is what it is moving forward. Is we're continuing to meet, continuing to discuss. Our next meeting is actually tomorrow. And so Madeline, if you want to even send me a direct message in the chat with your contact information, I can be sure to wrap back around with you, as well as wrap back around with the folks at OPDC to let them know sort of what the plan is for that. So
Madeline has a foot in both places. She has worked for us and she's a student at Pitt. So
yeah, for sure. Yeah, so Madeline, if you want to reach out, I'd be happy to get you an answer on that specifically. Again, because we're going to be meeting as a group tomorrow.
Thank you so much.
Mm-hmm.
So the university had published last year a set of postures that were sort of like defining the kinds of measures that they would be taking, and shifting between the kind of low, moderate, and elevated or guarded. I can't remember the names. Sorry, I don't remember the names of the different kinds of postures. And I'm just kind of curious to know if there is a similar kind of like scale that is being applied this year, where people can take note of, like, oh, we're starting to be a little more careful. Or if we're just going to be on elevated awareness all year long.
I would say elevated, awareness all year long, and so we're going to be again. We'll be shifting along with the local CDC response, and that's essentially the model that we'll be using to respond. That's what we've been doing this summer, is in order to respond to mask mandates and those type of things as well. And so that's something that we'll be continuing to do moving forward. As far as finding out what those status and what that status is, our Office of COVID Response will continue to put out messaging and continue to communicate to students and community, so that folks know what we're doing and what our stance is on something. So you could even see that I think our last the last message from that group came out just a few weeks ago, just sort of talking about how we'll be moving forward this fall, and I'm happy to share that in the chat. And so if folks can continue to monitor that, and that can be a great place as a resource for them that has better and more clear information than I do, that's for sure. So
yeah, we'll be sure to boost that. Thank you. Does anyone else have any other questions or comments or concerns, deep dark fears, hopes, dreams? Anything you'd like to talk about? I mean, if not, we can wrap up early, but happy to take questions from anyone.
And the other thing I did want to add, because I work with the School of Medicine, and so we actually had a small, large cluster of COVID cases. So we actually had to switch our facilitation groups to virtual for this week. So I would say that, be mindful that things are always evolving. So so just make sure that you're paying attention to your emails. So this is not a time to be like, let me just delete all these emails, or I'm not going to pay attention to the emails, because that's the fastest way that we can transmit information to everyone. So just keep that status, and that will let you see the different elevations and levels, because sometimes you can have a cluster of infectious people where literally that's now going to change what we're going to do for, you know, meetings and things of that nature. So I would say just be mindful of that, you know, it's always evolving. So, you know, just to, you know, and we're trying to keep track. So that's why, you know, making sure that you do get tested if you are having any symptoms, because that allows us to basically decrease and prevent from other people getting infected when you are going through the health center or things on campus for the testing, so we can track that.
Yeah, absolutely. And I just want to the second, since we have Madeline on here, who you say is a student, I want the second to check your email, be looking for those communications, because that continues to be important. And so it's, you know, I know sometimes you get all the emails and you just sort of slide it to delete, you know, if it, I don't put an alert, a flag on COVID in your mailbox if you can, so that way you'll be sure to be getting those messages.
Justin, I'm getting a question here in the chat asking whether or not Pitt checks its wastewater for COVID. Do you do that as a kind of a monitoring?
Not that I'm aware of, no.
So you're relying for information about infection rates in the students. You're relying on students to report it directly,
Yeah.
since it's not always the case that you're going to have access to, you know, like you're not requiring mandatory testing necessarily, and you're not like doing that kind of data collection yourself. So, you know, it's a honor system self-reporting.
Yeah, so that's why we're making sure we are channeling through student health services, because that's, you know, again, as Dr. Tripp mentioned, if that's where they're going, that's when we're going to know, and that's when we're going to be able to prevent folks from spreading the virus. You know, if they just say, you know, I know I'm going to handle this myself, or, you know, if they aren't, you know, go, you know, and we are providing that to students. I mean, so especially our students, I'll say, and our employees as well, but definitely our students, we are providing that to them. And so that's something that they can do through us. It's ease of access, it's ease of, you know, the financial commitment that they need, and so it's important for them to go through us because that just makes it easier. But then it helps us in spreading as well. So student health services as much as possible.
Okay. Anyone else has any other questions? Could be a very short let's talk. Let's just so we have a couple of thank you slides. I just wanted to append, I'm sorry, I wanted to note, so, you know, PDC, like many other organizations, we all went remote when the pandemic got started, and the shift to having community meetings like this one entirely online was initially painful, and now we've sort of gotten used to it. We have you know, we're still conscious of the fact that though this format is accessible to a lot of people for whom in-person meetings have always been inaccessible, there are still, you know, significant numbers of our population that we're serving that cannot participate this way, and that, you know, we're aware. We haven't yet come up with a very good solution, but if people on this meeting or in this call, if you have neighbors, if you have people that you are aware are having difficulty connecting to this kind of information, if you can either, you know, ask them to reach out to OPDC, or you know, with their permission, we're happy to reach out to them directly to be able to provide information on paper, to be able to provide recordings. We can do all of that. So please let us know and we will respond. But we have at this time no plans to resume in-person meetings at 294 Semple, which is on the one hand sad, and on the other hand, given the number of COVID cases that we had on staff this last spring, kind of a relief. So we are trying to keep you and us safe, and lamentable that that means that we can't quite get together quite the way we'd like. But for the time being, yes, safety is definitely our chief concern. So we have some meetings that are coming up and some events that are coming up here. I just want to be able to call everybody's attention to them. The Oakland Ramp Crawl is coming up on Friday. Always a good time. the Gainey Community Cookout East is on the 21st, so that's on this coming Sunday. And then next Sunday is the 8th annual Human Rights Cookout and Potluck. And I would encourage all of you guys to check those things out if you can. They are all outdoor events, and if you mask up, any luck, we can make sure that they don't turn into, you know, spreading opportunities. And with that said, thank you all very much for coming, and grateful as always to your time. Thank you so much, Dr. Tripp, and please extend our gratitude to Dr. Ho, and thank you, Justin. And if anyone has any other announcements they'd like to make, now's your chance. Going once, going twice.
I just want to say thank you all. It's been a pleasure. Definitely, if there's any issues or any questions that you have, you know, Andrea, you have my contact information, so please provide that to everyone. And again, I work at McGee and St. Margaret's hospitals, so I am in the ER there. So definitely, hopefully you don't see me, because if you do need to see me, that means an emergency is happening. So, but thank you all, and you know, and definitely it's been a pleasure, and have a wonderful day.
We're grateful to your time. A recording is going to be posted on our website, and you'll feel free to share the link, and we'll be back in touch with all of you. Thank you very much. Have a great evening, everybody.
Thank you.
Thank you all.
You're welcome.
Take care, everyone.